So let me discuss the contraindications of PDE5 inhibitors. So if you see the contraindications of PDE5 inhibitors, first and foremost, very important, these drugs have to be contraindicated in those individuals who have recent cardiovascular event. Recent cardiovascular event could be in the form of an acute myocardial infarction. And these phosphodiesterase inhibitors should also be contraindicated if the individual had taken nitrates, because even nitrates will also increase the nitric oxide levels, right? And further it will increase the cyclic GMP, and which will cause the relaxation of the smooth muscle within the arteries and arterioles. And whenever you are giving nitrates and as well as phosphodiesterase inhibitors concomitantly, there is massive increase in the nitric oxide, and which will make the individual to land up in hypotension and then collapse. So whenever the individual is on nitrates, please don't give phosphodiesterase 5 inhibitors. And in those individuals with hypotension, these nitrates are contraindicated. Right, in those individuals with hypotension, these nitrates have to be contraindicated. Then followed by that, in those individuals with anatomical deformity, right, in those individuals with anatomical deformity within the male genital organ. For suppose, if there is angulation of the male genital organ, right, if there is angulation of the male genital organ. And second important thing is, if there is cavernous or cavernosal fibrosis, right, if there is cavernosal fibrosis, then followed by that Peyronie's disease. So what do you understand by this term Peyronie's disease? It is a non-cancerous condition where there is accumulation of the fibrous tissue which has been scarred. That is what is called as the Peyronie's disease. And in this Peyronie's disease, there can be development of angulation within the male genital organ. So whenever there is anatomical deformity, right, these phosphodiesterase 5 inhibitors should not be given. Next, the another important clinical scenario where this PDE5 inhibitors are being contraindicated is whenever there is predisposition to prolonged erection. Right, whenever there is predisposition to right, so whenever there is predisposition to prolonged erection, what are the clinical scenarios where you can have this prolonged erection? Like sickle cell anemia. In sickle cell anemia, the individual can have priapism, right, where there is painful erection of the male genital organ. And then in other clinical scenarios like multiple myeloma and as well as leukemias. So in these conditions, there will be predisposition of the prolonged erection. So already when there is prolonged erection, you should not give this particular phosphodiesterase 5 inhibitors. So these are the contraindications: recent cardiovascular event, when the individual is on nitrates, or when the individual has hypotension, and if the individual is having anatomical deformities in the form of angulation, cavernosal fibrosis and Peyronie's disease. And when there is predisposition to prolonged erection like sickle cell anemia, multiple myeloma and as well as the leukemias. Now let me discuss drug interactions of right, let me discuss the drug interactions of the phosphodiesterase 5 inhibitors. First and foremost, the very important drug interaction is the nitrates. right? First and foremost, very important drug interaction is nitrates, right? Already I have said you, whenever the individual is taking these nitrates, phosphodiesterase inhibitors should not be taken, right? And what are these nitrates? Like for example, glyceryl trinitrate, isosorbide mononitrate or isosorbide dinitrate. These drugs, they are given in the treatment of angina, and right, and when you give these nitrates along with the phosphodiesterase 5 inhibitors, there will be massive increase, or there is significant increase in nitric oxide levels, and that will cause the hypotension and collapse. Now for suppose if the individual has taken the phosphodiesterase inhibitors, or if the individual has taken nitric oxide, so after what particular time you need to give the other drug, right? For example, you take Sildenafil or you take Vardenafil. So if the individual has taken Sildenafil, or if the individual has taken Vardenafil, right, if the individual has taken Sildenafil or Vardenafil, please remember the individual should not take nitrates until 24 hours, right? No nitrates until 24 hours. Okay, that is about your Sildenafil or Vardenafil. For suppose if the individual is taking Tadalafil, right, if the individual is taking Tadalafil, then no nitrates until 48 hours, right? No nitrates right? No nitrates until 48 hours. Okay, so nitrates, they are being contraindicated whenever you are giving this phosphodiesterase 5 inhibitors. And the other drugs where you have drug interactions with PDE5 inhibitors include cytochrome P450 inhibitors, right? The other important drug interactions you should know is cytochrome P450 inhibitors, right? And what are the examples of your cytochrome P450 inhibitors? Like protease inhibitor, right? And what are these protease inhibitors? Example, like you have ritonavir, right? You have ritonavir. So this ritonavir, it is the protease inhibitor, right? Which is a cytochrome P450 inhibitor. And these protease inhibitors, especially ritonavir, if you use in very small dose, they can cause significant increase in the levels of the phosphodiesterase 5 inhibitors, right? And apart from ritonavir, the other cytochrome P450 inhibitors include cimetidine, right? And third important drug, we have ketoconazole, then finally erythromycin. Right, finally erythromycin. So whenever you are giving this cytochrome P450 inhibitors along with the phosphodiesterase inhibitors, these cytochrome P450 inhibitors, they can cause significant increase in the quantity of these particular drugs, and where the individual can have hypotension and then collapse. And another very important drug interactions with the PDE5 inhibitors is the alpha blockers. Right, it is the alpha blockers. So these are the contraindications and drug interactions of phosphodiesterase 5 inhibitors that you have to remember. Okay, so contraindications: if there is recent cardiovascular event, please don't give PDE5 inhibitor. When the individual is on nitrates, or when the individual is suffering with hypotension, or when the individual is having anatomical deformity in the form of angulation, cavernosal fibrosis, or if there is Peyronie's disease. So if this particular anatomical deformities are there, phosphodiesterase inhibitors, 5 inhibitors should not be given. And when there is predisposition to prolonged erection, like in clinical scenarios like sickle cell anemia, multiple myeloma, leukemia, they have significant predisposition to prolonged erection. So in that clinical scenario, you should not give the phosphodiesterase 5 inhibitors. Then followed by that, if you see the drug interactions of PDE5 inhibitors, like nitrates. When the individual is taking nitrates, don't give PDE5 inhibitors and cytochrome P450 inhibitors, and then finally alpha blockers. Now, after having discussed about the mechanism of action of these drugs and dosages of these drugs, and we have discussed contraindications, adverse effects and drug interactions, let me just compare these three major phosphodiesterase 5 inhibitors. What are those three major phosphodiesterase 5 inhibitors? That include Sildenafil, Vardenafil and Tadalafil. Right? Let me compare these three drugs. So let me compare these three phosphodiesterase 5 inhibitors. So if you take the oral dosage of these three drugs, Tadalafil and as well as the Vardenafil, the dosage is around 20 milligrams, whereas the dosage of Sildenafil, right, the dosage of Sildenafil, it is around the 100 milligrams. Then followed by that, if you take the median time to peak concentration, right, median time, so if you see the median time to peak concentration for Tadalafil, the median time to peak concentration is around 120 minutes, and for Vardenafil it is around 40 to 60 minutes, and median time to peak concentration for Sildenafil it is around 60 minutes. Right, it is within 60 minutes. Now, followed by that, you should understand what is the half-life of these particular drugs. So, if you take the T-half of these particular drugs, right, that is in hours. Tadalafil, the half-life is around 17.5 hours, and Vardenafil, the half-life is around 4 to 5 hours, and Sildenafil, right, Sildenafil, it is around 3 to 4 hours. Then followed by that, you should understand food interactions, right, food interaction. So Tadalafil, it doesn't have any food interaction, right, whereas if you take this Vardenafil and as well as Sildenafil, the absorption of this Vardenafil and Sildenafil is being delayed upon taking high fatty food, right. So upon taking high fatty meal, right, upon taking high fatty meal, the absorption of Vardenafil and as well as Sildenafil is delayed, right. Absorption of Vardenafil and as well as Sildenafil is delayed upon taking the high fatty meal along with this drug. And what about the alcohol interaction? So if you see the alcohol interaction, none of these particular drug has interaction with the alcohol, right, none of these particular drug has the interaction with alcohol. So this is the comparison of these three drugs, that is Tadalafil, Vardenafil and as well as the Sildenafil. And apart from erectile dysfunction, please remember these drugs can also be used in the treatment of the pulmonary hypertension. Now, after having discussed about this phosphodiesterase 5 inhibitors, let me discuss like what are the injectable formulations that are being given in the treatment of erectile dysfunction. So the next important formulation for erectile dysfunction will be intracavernosal injections. So what are those formulations which can be given as the intracavernosal injections are the following. So we have a prostaglandin analog, that is a 𝐵𝐺 analog, and this particular 𝐵𝐺 analog, right, that is Alprostadil. Right, so 𝐵𝐺 analog, that is Alprostadil. So this Alprostadil, it is naturally occurring prostaglandin which is used in the treatment of the erectile dysfunction. Right, it is naturally occurring prostaglandin which is used in the treatment of the erectile dysfunction. And this particular Alprostadil, that is 𝐵𝐺 analog, it is also used in infants with the congenital heart diseases. Right, apart from erectile dysfunction, it is used in the treatment of the congenital heart diseases, that is patent ductus arteriosus. Right, it is used in the treatment of the patent ductus arteriosus, and it is given via intravenous route, and it is given in the form of the slow injection. And what is the use of Alprostadil in patent ductus arteriosus? This Alprostadil will keep open the ductus arteriosus until the surgery can be carried out, and in the form of injection into the male genital organ, or it can also be placed within the urethra. Right, this particular Alprostadil, this can be given either in the form of injection into the corpora muscles, that is corpora cavernosum or corpora spongiosum, or it can be also placed in the urethra and it can be used in the treatment of the erectile dysfunction. Now, what is the dosage of this Alprostadil? The dosage is around 5 to 40 micrograms. Right, the dosage is around 5 to 40 micrograms. And what are the common side effects? So, the common side effects of this particular Alprostadil, it includes the pain at the injection site. Right, so there will be pain at the site of injection, that is penile pain, and there can be also bleeding. Right, there can be also bleeding at the site of injection, and there can be prolonged painful erection of the male genital organ. Right, and there will be prolonged painful erection of the male genital organ, and that is called as the priapism. Right, that is called as priapism. So if you take this 𝐵𝐺, right, 𝐵𝐺 is in the vasodilator family of the medications. So what do? They open the blood vessels. Right, it is a vasodilator. Right, this is the vasodilator. So this particular Alprostadil, which is a vasodilator, it causes the opening of the blood vessels. Right, it causes vasodilatation of the blood vessels by smooth muscle relaxation. Right, it causes the vasodilatation of the blood vessels by the smooth muscle relaxation. And what are the medical uses of this particular Alprostadil? That is patent ductus arteriosus. It is also used in the sexual dysfunction like erectile dysfunction, and it can also be used in the treatment of critical limb ischemia. Right, it is also used in the treatment of the critical limb ischemia and also used in the treatment of contrast-induced nephropathy. So these are the uses of Alprostadil, which is a 𝐵𝐺 analog. Now let me discuss about the contraindications. Right, let me discuss about the contraindications of this Alprostadil. See, the contraindications of this Alprostadil is that if there is bleeding disorder, please don't give this Alprostadil. Right, so why? Because the adverse effect of this particular drug itself is bleeding. So if there is bleeding disorder, please don't give this Alprostadil, and this Alprostadil should also be not given in the clinical scenarios like sickle cell anemia, right, should not be given in the sickle cell anemia, and should also not be given in multiple myeloma and leukemias. Right, multiple myeloma and as well as the leukemias. So these are all the scenarios, right, where this alprostadil is being contraindicated, right, and there are certain drugs which can be used along with the alprostadil. The other drugs which can be used along with alprostadil, it includes phentolamine, right. So along with alprostadil, the other drugs that can be used is right, phentolamine, which is an alpha blocker, and other drugs that can be given is papaverine and as well as Erectile. Right, so these are the other drugs that can be given along with this alprostadil. So please remember, alprostadil is a PGE1 analog and the dosage of it is 5 to 40 micrograms and it is given as the intracavernosal injections. And very important point is that the supplementation or injection of the alprostadil is independent of the intact nervous system. When the nervous system or if the nervous system is intact or not intact, the injection of the alprostadil is independent of intact nervous system, right? So in what are all the clinical conditions we use this alprostadil? Patent ductus arteriosus, sexual dysfunction, that is erectile dysfunction, critical limb ischemia, and as well as the contrast induced nephropathy. And the adverse effects of this, the alprostadil, include penile pain, bleeding, and as well as the priapism. And contraindications of alprostadil includes bleeding disorders, sickle cell anemia, multiple myeloma, and as well as leukemias. And this alprostadil can be given along with phentolamine, papaverine, and as well as the avibutide. So this is about your injectable formulations, that is alprostadil. Now let me discuss what are the other forms of the treatment that is available for the erectile dysfunction. So after the treatment in the form of the oral medications and intracavernosal injections, we have the intraurethral formulations. Right, we have this intraurethral formulations. So even if you see this intraurethral formulation, what we have is alprostadil. Right, what we have is the alprostadil and the dosage of this alprostadil. Okay, but before that dosage, let me tell you, this alprostadil is given in the form of pellets, and these pellets, right, these particular pellets, they are inserted with applicator. Right, these pellets, they are inserted with applicator. Okay, now this alprostadil is given in the dosages of the following, like 125 milligrams, 250 milligrams, 500 milligrams, and 1 gram formulations. And after inserting the pellet with applicator, you need to massage the male genital organ. Right, and what is the purpose of this particular massage of the male genital organ? That is mainly to aid the absorption of this pellet. Right, that is mainly to aid the absorption of this particular pellet. And what will be the side effect of this intraurethral formulation of the alprostadil? This can cause penile pain. There can be also dizziness, right? So penile pain and as well as dizziness, and followed by that priapism, it is rare, right? Priapism, it is rare. So this will be the adverse effects with the intraurethral formulations of the Alprostadil. Then followed by that we have vacuum devices. Right, followed by that we have this vacuum devices. So what is this vacuum device and how is it being used? Let me tell you. This, with the help of this vacuum device, the penis is being erected, right? The male genital organ is being erected. Okay, so vacuum device has to be applied over the male genital organ and it has to be pumped. And with the help of this vacuum device, the male genital organ, it gets erected. So erected means what? The blood has entered, right? The blood has entered or trapped into the intracorporeal and extracorporeal compartments of the penis, right? The blood is trapped in intracorporeal and extracorporeal compartments of male genital organ, right? So the blood is being trapped in the intracorporeal and as well as the extracorporeal compartments of the penis. Now once the blood is being trapped in this male genital organ, a constricting ring should be applied at the base of the penis. Right, constricting ring should be applied, right? A constricting ring has to be applied over the base of the penis after the male genital organ is being erected with the help of the vacuum device. And this particular constricting ring, whichever is being applied at the base of the penis, it can be placed for a maximum time of 30 minutes. Right, this can be placed for a maximum time of 30 minutes. Now, what will be the adverse effect of this particular vacuum devices? This can cause cyanosis, right? This can cause cyanosis, edema and cold. So these will be the adverse effects associated with this vacuum devices. So after this vacuum devices, the other important modality of the treatment for the erectile dysfunction will be penile prosthesis. Right, penile prosthesis. So these penile prosthesis, these are semi-rigid rods. Right, these are the semi-rigid rods and these are being available as 2-piece inflatable prosthesis or 3-piece inflatable prosthesis. So it is available as 2 or 3 right. So these are being available as 2-piece or 3-piece inflatable prosthesis with abdominal reservoir. And what are the adverse effects or risks associated with this penile prosthesis? They include number 1, infection, right? Number 2, this penile prosthesis will also destroy corpora cavernosa. Right, they will destroy corpora cavernosa and there can be erosion and extrusion and there can be even mechanical failure of this penile prosthesis. So apart from the oral medication, the various other ways by which you can treat the erectile dysfunction is intracavernosal injection, intraurethral injection or intraurethral formulations, and these intraurethral formulations are in the form of pellets. And what is that particular formulation? That is Alprostadil, which is PG-even, and these particular pellets are being inserted with the help of the applicator, and the dosage of this Alprostadil is 125, 250, 500 milligrams or the 1 gram. And after the inserting the pellet with the help of an applicator, you need to massage the male genital organ, and that will aid the absorption of this Alprostadil. And the adverse effects of these intraurethral formulations include penile pain, dizziness, and as well as the priapism, which is a rare event or rare phenomenon. And the other thing like what we have is the vacuum devices. So this vacuum device has to be applied over the male genital organ and it has to be pumped. And once you pump with the help of the vacuum device, like the male genital organ, it gets erected. So the blood is being trapped in the intracorporeal and as well as the extracorporeal compartments of the male genital organ. Now once the blood is being trapped and once the male genital organ is being erected, a constricting ring has to be applied over the base of the penis, and that constricting ring will not allow the flow of the blood back. The blood gets completely trapped and thereby there will be maintenance of erection, and the maximum time for which you can apply this constricting ring is up to 30 minutes. And the adverse effect of these vacuum devices include cyanosis and as well as the edema. And lastly, the treatment of erectile dysfunction can be done with the help of the penile prosthesis, and these are available as semi-rigid rods and they are available as 2-piece or 3-piece inflatable prosthesis, right? And the risk of this particular penile prosthesis include infection, there can be destruction of corpora cavernosa, and there can be even mechanical failure. So these are the various methods by which you can treat the erectile dysfunction. Now let me discuss the drugs which will cause the erectile dysfunction. So if you see the drugs which will cause erectile dysfunction, first important group of drugs are the antihypertensives and as well as the antidepressants. And what are those antihypertensives and antidepressants? Let me discuss. Right, antihypertensives and antidepressants. And this particular antihypertensives, they mainly include the beta blockers, right? They mainly include beta blockers. And apart from beta blockers, we also have diuretics, right? So these beta blockers and as well as diuretics, and that to which particular diuretics? That is mainly thiazide group of diuretics, right? That is hydrochlorothiazide. So this thiazide group of diuretics, they can cause the erectile dysfunction. Then if you take the antidepressants, they include amitriptyline, then sertraline, then the next important drug like what we have is fluoxetine. These are the antidepressants which will cause the erectile dysfunction. Then followed by that, antipsychotics. Antipsychotics include chlorpromazine and as well as risperidone. So if you see this antipsychotics, they include chlorpromazine and then right, and then we have risperidone. So these are the antipsychotics which can cause the erectile dysfunction. And among the beta blockers also, which particular beta blocker will cause the erectile dysfunction? That is propranolol, right, propranolol, and then followed by that atenolol, right, then followed by that atenolol. And apart from this antihypertensives and antidepressants, the next group of drugs like what we have is the statins, which will cause the erectile dysfunction, right? And next to this particular statins, we have antipsychotic drugs. Antipsychotics already we have discussed, that is chlorpromazine and as well as the risperidone. And apart from this, we have certain group of drugs which are less likely to affect the sexual function. And the drugs which are less likely to affect the sexual function, that includes calcium channel blockers and as well as the AC inhibitors. So calcium channel blockers and as well as AC inhibitors, they are less likely to cause this particular erectile dysfunction. So this completes the etiology which will cause the erectile dysfunction. So in this erectile dysfunction, you need to know what are the drugs which will cause erectile dysfunction and what are the other etiologies which will be causing this erectile dysfunction, because if you know the drugs causing erectile dysfunction, once you stop that particular drug, then the erectile dysfunction, it gets corrected. So this completes the discussion of this very important topic, that is drugs used in the treatment of erectile dysfunction. So one is your phosphodiesterase 5 inhibitors, then intracavernosal or intraurethral Alprostadil supplementation, then followed by that penile prosthesis. So these are the various ways by which you can treat this important disorder, that is erectile dysfunction.